Imagine a man named John, out for his daily jog in the park. The morning is crisp, and the air is filled with the scent of blooming flowers. He's enjoying the fresh air and sunshine, lost in thought, reflecting on the events of the week and planning his day ahead. Suddenly he trips over an exposed tree root, his foot catching it unexpectedly. He falls hard, scraping his knee on the rough pavement, the impact jarring his entire body. John winces in pain, looking down to see a gash on his knee, the skin torn and raw. Bright red blood wells up from the wound, a stark contrast against his skin, trickling down his leg. He feels a surge of adrenaline, a mix of shock and the body's instinctive response to injury, his heart pounding in his chest. John knows he needs to take care of the wound, but first he needs to understand what's happening inside his body, the mechanisms at play. This seemingly simple injury sets off a complex chain of events, a remarkable cascade of processes designed to protect and heal, showcasing the body's incredible ability to respond to harm. When John's skin tears, the delicate blood vessels beneath are also damaged, creating an immediate pathway for blood to escape. These vessels, responsible for carrying oxygen and nutrients throughout the body, are now open conduits, leaking precious fluid. Blood, the lifeblood that sustains us, begins to escape, flowing out in a vivid stream. This bleeding is the body's way of signaling that something is wrong, a distress call that cannot be ignored. It's an alarm system, alerting us to the injury and triggering a cascade of responses designed to protect and heal. The bright red color of the blood indicates that it's rich in oxygen, fresh from the heart and on its way to nourish the body's tissues, now diverted. John watches with a mix of fascination and apprehension as the blood flows freely, each drop a reminder of his body's vulnerability. It seems like a lot, but his body is already working tirelessly behind the scenes to stem the flow and begin the intricate process of repair, deploying cells and proteins to the site of injury. Within seconds of the injury, tiny cells called platelets, circulating in the bloodstream, rush to the scene. These remarkable cells, shaped like tiny plates, have a crucial role to play. They are the body's first responders, arriving at the wound site, ready to plug the breach. Platelets are sticky, and when they encounter the damaged blood vessel walls, they adhere to the exposed collagen fibers. Imagine them as tiny pieces of tape, sticking to the rough edges of the wound and to each other, forming a plug. As more and more platelets arrive, they begin to stack up, creating a temporary barrier against further blood loss. This platelet plug, while fragile, is a crucial first step in the clotting process. While the platelets are busy building their initial plug, another set of players enters the scene: clotting factors. These proteins, circulating in the blood in an inactive form, are activated by the injury. They set off a complex cascade of reactions, ultimately leading to the formation of a stronger, more stable clot. One of the key players in this cascade is fibrinogen, a soluble protein that gets converted into fibrin, a thread-like protein. Imagine fibrin as a mesh net, woven by the clotting factors, that traps red blood cells and platelets, further strengthening the clot. This intricate interplay between platelets and clotting factors transforms the initial fragile plug into a robust clot, effectively sealing off the damaged blood vessels and preventing further blood loss. Section 5. The clot's triumph: bleeding stops. As the clot strengthens, the bleeding gradually slows down and eventually stops. John notices with relief that the flow of blood has diminished to a trickle. The clot, now a dark red mass, acts as a protective barrier, sealing the wound and preventing further blood loss. The formation of this clot is a remarkable feat of biological engineering, a testament to the body's incredible ability to protect itself. It's a complex process involving multiple steps, all precisely orchestrated to ensure survival. But the story doesn't end there. The clot is just the beginning of the healing process. Underneath this protective barrier, a series of equally fascinating events is already underway, setting the stage for tissue repair and regeneration. Section 6. Inflammation sets in, a necessary discomfort. Within hours of the injury, John's knee becomes inflamed. The area around the wound swells, turns red, and feels warm to the touch. While uncomfortable, this inflammation is a normal and essential part of the healing process. Inflammation is the body's way of bringing in reinforcements. It's a coordinated response that delivers immune cells, growth factors, and other necessary components to the injury site. These cells work together to clean up debris, fight off infection, and lay the groundwork for tissue repair. John might be tempted to reach for a pain reliever to reduce the swelling and discomfort, but it's important to remember that this inflammation is a sign that his body is working hard to heal. Section 7. New tissue emerges. Rebuilding begins. As inflammation subsides, a new phase of healing begins. Tissue regeneration. Cells called fibroblasts migrate to the wound site and begin producing collagen, a tough, fibrous protein that provides structural support to tissues. Imagine collagen as the scaffolding upon which new tissue will be built. Fibroblasts work tirelessly, laying down new collagen fibers, gradually filling in the wound from the bottom up. This process of collagen deposition can take several weeks, depending on the size and depth of the wound. During this time, John's body is diligently working to rebuild the damaged tissue, restoring its integrity and function. Section 8. Scar formation, the final mark. As the wound continues to heal, the initial red raised scar gradually fades, becoming paler and flatter over time. This scar tissue, although different in composition from the original skin, provides strength and stability to the healed wound. Scar formation is the body's way of making a permanent repair to the damaged area. While scars may serve as a reminder of the injury, they also represent the remarkable ability of the body to heal and regenerate. John's scar, a testament to his body's resilience, tells a story of healing and recovery. It's a mark of an experience, a reminder of the body's incredible ability to overcome injury and adversity. Section 9. Minor wound care at home cleaning and dressing. For minor wounds like John's scraped knee, simple first aid measures at home are usually sufficient to promote healing. The first step is to control bleeding by applying gentle pressure to the wound with a clean cloth. Once bleeding has stopped, the wound should be cleaned thoroughly with soap and water to remove any dirt and debris. Applying an antibiotic ointment can help prevent infection and keep the wound moist, which can promote healing. Finally, cover the wound with a sterile bandage to protect it from further injury and contamination. The bandage should be changed daily and the wound kept clean and dry. Section 10. Seeking medical attention. When expertise is needed. While many wounds can be managed at home, some situations require professional medical attention. Deep wounds, wounds that are bleeding heavily or won't stop bleeding, and wounds showing signs of infection should be evaluated by a healthcare professional. Signs of infection include increasing pain, redness, swelling, warmth, pus drainage, and fever. In such cases, medical treatment may involve stitches, antibiotics, or other interventions to promote healing and prevent complications. John, being generally healthy and having a minor wound, is likely to heal well with home care. However, it's always best to err on the side of caution and seek medical advice if there's any doubt or concern. Section 11. The remarkable journey of healing, a testament to the body's resilience. From the moment of injury to the formation of a scar, the body embarks on a remarkable journey of healing. This journey is a complex and fascinating process that showcases the body's innate ability to repair itself. Blood clots, often seen as a nuisance, play a vital role in this process, stemming bleeding and providing a protective barrier for tissue repair. These clots are the body's first line of defense, initiating the healing process almost immediately after an injury occurs. The next time you get a cut or scrape, take a moment to appreciate the intricate cascade of events occurring beneath the surface. Cells rush to the site, working tirelessly to close the wound and prevent infection. It's a testament to the body's incredible ability to heal, a reminder that even in the face of injury, our bodies are remarkably resilient. This resilience is a marvel of nature, allowing us to recover and continue with our lives. And as for John, he'll likely be back to his daily jogs in no time. A bit more careful next time, but with a newfound appreciation for the remarkable healing powers we all possess.